Hi everyone, Dr. Brandon here. Today I wanted to talk to you about something that you may have heard about on social media or online, and that is the Deep Plane Facelift. What is a Deep Plane Facelift? What does that entail? And how does that make your results better? There are many different types of facelift techniques, and the Deep Plane Facelift technique has actually been around for several decades. And over time, there have been some innovations in the technique itself that make it, in my opinion, one of the most powerful tools that a surgeon has in facial rejuvenation. One of the things that I think needs clarification is that when a surgeon says facelift, we're not talking about literally lifting the entire face up. When a surgeon mentions the word facelift, we're generally referring to several different regions of the face. That is the mid-face or the cheek, the jawline, and the neck. Now, many older types of facelifts do a decent job at addressing skin laxity along the jawline and the neck, but really fail to do much improvement in the cheek here. So it doesn't do a whole lot of improvement along the folds that start to form along the side of the mouth and the nose. And that's where I think the Deep Plane Facelift really does shine, because it addresses all three areas in a very, very profound way. So some of the older techniques of facelifts address only the skin. So quite literally, the surgeon would free up the skin, pull the skin tight, and suture it closed along incisions around the ear. And there are several issues with that. First, that means that the skin is repaired or sutured closed under tension. Tension is the enemy of a good healing incision, and frequently the reason why you may see people with facelifts walking around with thick, red, or ropey looking scars around the ear. It also leads to a higher rate of different deformities, such as the pixie ear deformity where the earlobe can pull down. And it's also like tightening the sheet, the top layer of the skin on top of other structures that have also fallen. So one thing to know is that the face ages in many different layers. So it's not just skin that is starting to sag, but also muscle and fat. In fact, it's even more complex than that. But when you just tighten the skin over muscle and fat that has fallen, that's when it can look very unnatural. So you need a technique that addresses all three of those layers to get the most natural result. And that's where the facelift really is different than many other styles of facelifts. What actually happens in the facelift is there are incisions that are made around the ear, in the front and the back, and there is dissection underneath the skin up to about the level of the eye and down to the jawline here. At that point, the surgeon transitions to a deeper layer of tissue, hence the name Deep Plane, and that's below what is called the SMAS. The SMAS is a muscle and fibrous layer of the face, and that is frequently what has started to sag over time. And so in the Deep Plane Facelift, you release that layer, and you also release several different areas of tension or anchoring points in the face to allow passive or easy repositioning of the fallen tissue. So those anchoring points in the face are here, 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 and actually down along the neck. So a true extended Deep Plane Facelift actually releases all of those anchoring points. Those points are tethering the tissue down in the position that they are. So once those are released, you can move the face almost in any direction that you want, and you can do it under no tension. And so when you lift the face, everything just sort of glides and is repositioned up into the place that the surgeon wants it. The skin comes along for the ride. So instead of being stretched or pulled or sutured under tension, it is just passively put together. So the edges are just kissing basically and sutured gently together. That leads to a much better healing scar, and overall, I believe, a more durable result. It's going to last longer than many other techniques of facelifting, and it looks more natural because you've addressed all the different layers of aging rather than just the top layer. So overall, I do think the Deep Plane Facelift has really made significant advances in facelift surgery in general. It leads to more natural looking results and results that look better